So I happened to just stumble upon Dr. Ashish Paul on a live. Like I just picked up my phone, turned on TikTok, and she was there, and I was like, what? She was giving such amazing information about hormones, nutrition, supplementation to help women over 40 conceive. And I was like, I found my person. So ladies, you guys are always asking me fertility tips. And I'm like, I conceived naturally. I didn't have to go through needing a fertility specialist. And I need to connect you guys up with specialists who can answer all your questions. So Dr. Paul, I don't know, can you see the comments that are coming through?
Yeah, I can see the comments. Yes.
Good. So I'm going to give her an opportunity to read some of them and start answering away. And also, if you want to give an intro about yourself, actually, I should not. Let you introduce yourself. I'm sorry.
That's okay. That's okay. Thank you so much. And thank you for waiting, everybody, and also asking questions. So we're going to have an amazing session. I'm here to answer any questions that you have. I have been a holistic medicine practitioner for 30 years and plus. And somebody said, oh, you look too young to be doing this, but that's how it is. What can we do? And I have a story of my own. I don't like to call it infertility because I like to call it fertility journey. So we conceived in the 10th year of our marriage with IVF. And my IVF story is like first time, 3 weeks later, I was pregnant with twins, which is a very, very small percentage of women. It's like only hardly under 1% of women, and then went up to 37 weeks, full-term pregnancy. When my twins were little, and I used to take them to this twins and triplet club, and that's where I started hearing women's stories of having 5 cycles of IVF, 7 cycles of IVF, because my limit for myself was 1 cycle. You know, that was me and my husband's limit, 1 cycle. Whatever God gives, we're going to take that. And it just worked. But that's when I started hearing stories and I thought, why don't we do anything natural? We have got so many resources, so much stuff, herbal medicine, therapies. And that's how my journey started. My twins are now 16 years old, boy and a girl. But that's where I started from. And I am going deeper and deeper and deeper into this whole situation related to fertility, and women are losing out big time. So that is why I share so much information related to how natural medicine can support. And it is all related to our health, and doctors say so many things which has got no basis, that you will never be able to get pregnant with endometriosis. And there are endometriosis women patients who are walking around with kids, or PCOS or something else, or age related, for example, so that's my story in a nutshell. And I am I'm very blessed and fortunate. And that's why I find it really, I understand the pain. I have been through the pain myself. So I know that it is difficult and there is no resource available. Women really don't have enough support at any step. You conceive, even with IVF, you go to IVF clinic and you're discharged once you have positive pregnancy, and then you're on your own, So, yeah. So thank you, Chia. That was
Yes, absolutely. Absolutely. So let's give you a moment to kind of scroll through these questions here, because there's some good ones, huh?
Yeah, there are. So where shall we start? Shall I start from the top?
Yeah, let's see. So yeah. Okay, good. So by time you pop on, oh, somebody asked me a question.
Yeah.
Where was it? Any advice for someone who had tubes tied and is doing IVF? This is beautifully chaotic. I hope you're still here.
Tubes are tied and then they're doing IVF. Mm-hmm. Yeah. So, one route to go, and I have seen this happen, is you can open your tubes and you can still get pregnant naturally. If you are under 40 or under 35, you can go via that route. Okay. Other route is that you don't do any of that. You go straight for IVF. Yeah. So those are the 2 options to begin with. Secondly, if you are going to choose IVF, then making sure you and your husband I think husbands and partners are missed out of this conversation, and it is not serving women. So make sure that both of you prepare yourself for 3 months. Now, my preparation looks different from what normally women do, which is taking some supplements, taking, folic acid, or taking some basic stuff. I am talking about taking herbs which can actually heal you, which has the potential to change, internally, make your reproductive system really well, and also overall to be healthy. If you're not overall healthy, you're not going to be able to, even if you do conceive, you can't keep that pregnancy because your health is not there to support it. Yeah. So give yourself and your partner 3 months, prepare for it, and then go for IVF. If you want to open your tubes, you can still take natural therapies we do in the clinic, which are deep abdominal therapies to help you to heal afterwards so that you can then get pregnant that way. Probably a little longer route, but it all depends what you decide as a couple, between the two of you. But both ways, keep herbs and natural therapies with you.
Good. Very, very good. And then, so let me scroll here. So we have Dr. Ashish Paul, natural fertility expert. I want you ladies to have all your questions ready. So then Bad24 says, it's very difficult for someone with rhesus. I think she says rhesus, but I think it's rhesus, right? Negative blood to carry full term.
I carried twins with B negative blood group. So it is not, it is dependent on, on your health. And if you take precautions to begin with, and that is where, some extensive testing helps in this kind of scenario. And for those, not in your case, but maybe there are other women who lose pregnancy because of that. Because negative, Rh negative can make you lose pregnancy if the baby's, blood type is positive. In my case, my twins are both negative, so we didn't have to have anything for it. But you can have the antigen injection, so that you don't go through this. So that is something you will have to prepare. But yes, you can go through full-term pregnancy. Should not be an issue.
That's fantastic. And then let me see. Okay, so and she's saying I carried 5 times and did not make it past 5 months. And each time they said it's because I'm rhesus negative. That was the reason they said, and the injection did not work.
Oh, right. Well, if that is the case, that injection has not worked, that means there is something, just logically speaking, if you follow a little bit of science, is that there is something in your body's immune system which is rejecting it. Yeah. Because your body has to be in that place to accept it. So, we can work on immune system to give it, good 3 to 6 months, depending on your age again. Otherwise, if this is losing 5 pregnancies and babies is a lot to deal with, so if that is the case, then going down, I don't know, surrogate route is another route that you can go down if it is possible for those it is possible for, which is not easy in any way. But we can work on immune system because that is why your body is rejecting, even the injection.
Okay, good. And then, so now we have Tivia, how can we become our most healthy to prepare to welcome a baby and sustain pregnancy? Just thank you so much. I am 40.
So I normally say that anybody who is above 40, okay, unless you are an athlete fit or fit athletically, that you are really super fit, if not, then wherever your health is right now, to improve it 4 to 5 times, okay? Whatever you can do, I'm not saying this is going to happen overnight, but you can easily do better effort in every part of your life and lifestyle, diet, nutrition, living, sleeping, work environment, home environment, for consistently for 3 months. Yeah. As well as, please remember, your the quality of embryo and the quality of your pregnancy is not just only coming from your health. It is coming from the health of your partner. Okay, it is coming from the sperm quality. Early pregnancy loss, which happens up to 12 weeks, one of the major factors is the morphological issues or genetic material issues with sperm quality. Okay, and that is something that nobody talks about. I haven't seen that we talk enough about preparing men for for pregnancy. Whereas in Ayurvedic medicine, for example, in natural medicine, what I practice, we start from there. We detox both partners. We start with their health. We tell them what they both should do, and we teach them also relationship stuff so that they can connect better. That's where it starts from. But we don't do any of that. So please keep that in mind. If you're 40 plus and your partner must be similar age, then he and you, 3 months is not a long time to consistently work on your health. If you really want a result which is as miraculous as having a baby. So that is my advice. And then take advice, help from, if you know a herbalist, you know a nutritionist, you know a fertility massage, you know somebody else, but you got to do it consistently. I know so many people who do fertility massage or acupuncture session. They do one session and that's it. And they say it doesn't work. You can't do with one session, right? If something you're trying to conceive and it hasn't happened yet, means your body does not have enough resources yet. That's nature's way. If it does not have enough resources, it's not going to carry on, having the conception or conceiving and then carrying on with that baby. So make yourself healthy.
Yeah.
Is the bottom line thing with all of this. And I will tell you also, Chia, when I look back at my own journey, when I conceived after 10 years, I was super healthy. My husband at that time, he's no more, but he was super healthy. We had no health issues. But when I look back, I was doing everything. I was taking herbs for almost 2 years. Okay. I was doing yoga every single day for an hour and a half because I was a practitioner myself. I was rather training to be a teacher, training to be a yoga practitioner when I was pregnant.
Wow.
So I was doing all of this stuff, even though I was fully 100% healthy. And then IVF worked first time. So I connect the dots that way. That is why I'm so hot about doing all that you can do to improve your health.
Yeah. And I have to say that makes total sense. Women always ask me about my pregnancy journey. And that's one of the things. It's like I tell people I never did drugs. I had been an athlete all through college, and not that you have to now become an athlete, because I haven't been a competitive athlete in over 25 years, but I kept myself fit. I stayed active. I stayed happy. I didn't keep toxic relationships. I took my supplements. I went out in the sun. I rode my bike. I exercised. And my man, the same. He was supplementing and he knew he had low testosterone. And so he was, and not to say that men have to take testosterone supplements, but he knew he had a health condition to handle. So we were in the sun, we were exercising, we were never fighting, we were enjoying ourselves. Sex was compatible. And I even talked with a practitioner who was like, the fact of having the big O in your TikTok will cut me off if I say certain things. So I'm going to say your proactivities, when you're knowing your man, it has to be enjoyable because the big O helps move the sperm through the channel. And sometimes when you're trying to conceive, I hear the big S can get dry because you're just trying to do the mechanical things to make the baby come. But nature is not dumb. You have to actually be enjoying the process and having the O to move the thing. So we had all those things going for us, right? So you have to be healthy, both of you. And he was taking supplements too. It was both of us. So somebody was asking about herbs. Like, what are some herbs that you would recommend? And somebody asked me about that yesterday, about fertility teas and herbs. I never did herbs or fertility teas. So maybe you can speak on that.
Yeah. So look, we have got, around the world, we have got about 1,500 different herbs, more or less, which we use in different Ayurvedic medicine, use something Western herbal medicine use something else, different countries. So we have got hundreds of herbs that you can use. I don't personally give out names of herbs on a live because I don't know your medical condition and I'm not allowed legally to tell you names of the herbs. But if you were to consult me, that's when I prescribe herbs for you. That's how you should be using herbs. So not over the counter. Go and see a herbalist who can actually prescribe herbs for you. But we have got herbs for everything, to improve your uterine lining, to improve your ovarian function, to improve your thyroid health, which is linked again to overall your health, to improving your liver health. We have got amazing herbs for liver health because liver health is required. Somebody who has got high estrogen levels or something else is not working in your hormones. So there are so many different herbs, and please don't take herbs over the counter because that is something, it's like hitting in the dark. You don't know what you're doing. And most of the herbs that are available from health food shops, they are not really herbal medicines. They don't have enough dosage in them as compared to what we give as herbalists is completely different. The dosage will be, or the active component in that herb will be much higher. And also because then I will be supervising you as a practitioner, only then you can take it. Because anything, even though herbs are very gentle, but you don't want to spend your money on something which is not giving you any value, So that is my take on herbs, but we have got all sorts of herbs. And I give that to my patients as well. But one single herbal tea is not going to be enough. You're going to need the whole strategy.
Comprehensive plan. Hey, ladies, if you are enjoying this live, can you give us some hearts and some love? TikTok will put out this live to the degree that it knows that it is fire and you guys appreciate it, that we are here answering your questions. So can we just take a few moments for all the hearts, all the gifts, whatever it is that you can do, just tap those screens. If you appreciate me and Dr. Paul coming here and giving our time for you guys, TikTok needs to know that you love it. So let's get going on the taps on those screens. I appreciate it. So now somebody says she wants to know, do you have specific tips for health and fertility after my myomectomy? She's 38 years old. First of all, what is a myomectomy?
Yeah. So myomectomy is when you remove polyps, fibroids. It's an operation to remove those growths from the uterus. So it can be an open surgery, depending on the size of those growths, or it can be vaginally can be done as well. So depending on the location as well, size of it, the whole thing. My recommendation, if you have had an operation like that, even if it has been a minor operation, every operation that we do, anything that we introduce, even like those microscopic, the things that we introduce through vagina and we are looking at internal organs, it is a foreign body for your system, yes? And your body then creates what we call different adhesions, and it is very common with operations. So you should be doing more deeper abdominal massages, as many as you can do, depending on your budget, depending on your time, resources, availability of a practitioner nearby, because that deeper abdominal treatment will help those adhesions not to form, because they can cause an issue when it comes to fertility further on when you're then afterwards trying to get pregnant. After a myomectomy or any operation like that, endometrial surgery, give yourself 3 months minimum. Actually, 6 months is a recommendation, depending again on your age and depending how big the operation was. But give yourself 3 months. Once you have gone through the basic 6 weeks or 8 weeks after the op, start going for therapy, which is body therapy, natural therapies, contact therapies. We do so many Ayurvedic therapies in our clinic. And use herbs. Remember, any medical drug, it does not heal the body. Only herbs have some potential to heal your tissues, okay? So we have healing herbs that you can use, and there are lots of ways to do that. So for example, you can take herbs in different formats, capsule, tablet, powder, different tincture format. You can also apply herbs locally. We use herbs like castor oil, people are applying, or other herbs, and like a poultice you can apply on the stomach. You can also use herbs vaginally, like I give I gave a ghee formation, which then women apply either with a tampon or with fingers, however it is convenient for them. I also give a yoni soak. Every woman who has gone through any operation like that to do with where vagina has been involved, to do what we call sitz bath. Yeah. So you have herbal soak and you sit in it. Okay. These are my recommendations to really properly, truly heal from it.
Great. These are fantastic tips, and I really like that how you stress, like, don't just arbitrarily go shopping for your own herbs, not knowing what your condition is and how much of the herb you may need. If only, it probably won't hurt, but it may not help, but it will hurt the pocketbook if you're just doing the wrong things. So I like that. And so Arama Music asked, what types of herbs were you taking and in what form? So I think she just kind of went over that with the herbs. I hope that was enough. Same thing, Constant Change, you were asking about herbs. You know, she's limited to what she can say. Marissa says she's doing self-massage, but will look for a practitioner. Yeah, what kind of practitioner are we looking for? Like, should they be looking for to do this particular massage that you're talking about?
Yeah. So self-massage is great for those days when you can't go to practitioner. But going to practitioner helps because we can't really massage nicely ourselves, you know, and it is nicer to have someone working on us. And the kind of practitioners that you can look for is Ayurvedic massage therapist. You can look for naturopaths. They might be doing, some naturopaths do treatments as well. You can look for a massage therapist of any kind, as long as they have some experience to work with pregnancy and with women's health. Because not every massage therapist or practitioner actually do deeper abdominal lymphatic kind of massage. So lymphatic massage is another one. If somebody is offering that, you can go and get that done. But you want some form of massage which is on the abdomen and also on the back, you know, on the thighs as well, because these are the areas we want more blood for. We want more nutrition in this area.
Fantastic. Fantastic. Ladies, thank you. Let's get to tapping those screens. You know, this live has 2,000 likes, and that is probably one of my lowest likes I've ever had. And I know you guys love this content. I think you're riveted and you forgot to tap your screens. So if you guys like us being here, I need you to tap those screens, because that's how TikTok knows it's good content and they know to push the live out to more people. So many women are trying to conceive, whether they're in their 20s, 30s, 40s. I hear from all age ranges. And we have a fertility specialist here on the line. Come on, let's push this live. Let's tap those screens so TikTok knows that it's good. Okay, good. How do you find the hearts? Just tap your screen. If you tap your screen, the hearts pop up. It's so easy. TikTok is just like, just tap it, tap, tap, tap. So what type of practitioner prescribes herbs? Now, she's in the UK, right? And I think most of us are in the US. I don't know if this changes across countries or not, but I'll let you answer this question with that viewpoint in mind.
Yeah. So I send medications around the world as well, if anybody's interested. So that's one option. Second option is locally, you can look for an Ayurvedic doctor who can prescribe herbs to you. You can also look for a herbalist who can prescribe herbs for you, a naturopath who can prescribe herbs for you. Of course, with the local laws and stuff has to be, honored and has to be looked at, whatever it is. But I can prescribe herbs internationally. I know that certain countries have a difficulty getting herbs. For example, somebody connected with me from, I think, Barbados or one of the islands, and she said there are very strict laws because of the drugs. So I will not be able to get this from you, even though this patient was very interested. So wow. Yeah, those are all the practitioners that can prescribe herbs for you properly.
Yeah, hopefully, right? Okay, good. So Cindy says she had a miscarriage due to high blood pressure. So this is something that I dealt with. All the doctors, every single doctor that I saw was on me about taking baby aspirin to prevent preeclampsia, high blood pressure. I did not take any medication. I personally maintained a high protein diet, which I understand is a means for averting preeclampsia. That worked for me. But let's talk about this natural ways to keep the blood pressure down.
Yes. How old are you, the person who's asking?
Cindy, if you're still here, Cindy Modi, how old are you?
So I'll start answering, but you can tell me how old you are. So Yes, so preeclampsia or high blood pressure during pregnancy. So pregnancy itself is a highly vulnerable and stressed situation for body system, body mind system of the mother. So it's a lot for the body to deal with at any age. It's regardless the age. I'm not even talking about at any particular age. But what works really well for anybody who has got nervous, anxious, paranoid kind of personality. Okay. Even if you have a personality which we call moody personality, yeah, where you are up and down. One day you're happy, one day you're not, which we call like bipolar kind of personality. I'm not saying you have bipolar, but it is a personality like that. Those people should learn to do breath work and breath work like a medicine every single day. If you can train your body how to deal with the stress and how to lower your blood pressure. So blood pressure is not necessarily heart's issue. Blood pressure is an issue of your mind because your mind is racing your heart. Yeah. And that is what is causing anxiety, makes the blood pressure rush around, and that's when we have issues about it, because then during pregnancy there is your heart and baby's heart and there's too much going on. So anybody who has a history of that, and even if you have history of slightly high blood pressure, do whatever doctor is asking you to do. If aspirin they're giving you, take it. If it can't be avoided, if they're not listening to you. But if you can work on your body and mind system, especially your mind, and know your triggers for your stress, yeah, that works really well. And then there are some yoga techniques that work really well. So wherever you are, learning yoga works really well. Yeah. But my biggest thing is breath work. Every single patient of mine, whether they are for fertility or something else, they all have to do breath work. Breathing works like magic. Okay?
Wow.
So that's my very kind of top advice. But yes, you have to go deeper into it and do more breath work and learn properly with the practitioner.
Wow. That's fantastic. Thank you guys for helping figure out how to put hearts on a live. So yeah, I guess you guys have to specifically tap my box. You want hearts for me? Tap my little host box up there. Hearty heart heart the live. Let me see. Oh, this sounds very interesting. Doctor said that are you still there, Dr. Paul? Oh, there you go. Doctor, yeah.
I was trying to do heart.
Oh, you're trying to do heart. You don't heart. We let them do it. We're talking, they heart. So you guys tap our boxes to love the live so that TikTok pushes it out. So Tiva says, the doctor says that if there is no prior conception prior to age 35, that the channels are not open to conception.
Oh, this is rubbish.
Rubbish. Bull rubbish.
Bottom line, my very simple answer. It's not true. It's not true. So what you need is a healthy system that is working. So yeah, it's not correct.
Okay, great. So Beans says she's 25 with PCOS. I would like to have kids. What can I do to prepare now? I'm so happy that you're talking about this at 25. That's very smart. Very smart, Beans. I hope you're still in the house. Are you still here, Beans? Let me know if you're still here, but we're going to answer that anyway, because I love that someone who's in their 20s is looking to protect their fertility. Okay, yeah, she's still here. Great.
I think, so one of the things with women who have either PCOS or any gynecological related issue, PCOS and endometriosis is one of the biggest issues we have. I think you should look into freezing your eggs because that can really help you. It gives you more possibility. It's not a 100% guaranteed thing, but it does open up more possibilities for you. Also with PCOS, we know that, the egg quality is not always there. And that is why it will be a great idea to save up for it and and keep some of them healthy in the bank. And also you can, for those who have a good, healthy relationship and a good partner with them, it's better to freeze embryos because that freezing works better than just freezing eggs.
Oh, can you talk about that? Like, what does that mean? I've never heard of that. Freeze the whole embryo. So what is that?
Yeah. So you So rather than just freezing egg, because you are going through so much process already, but you obviously need a very strong, secure relationship for that, and knowing that, okay, this person is going to be with you. But you can freeze embryo. You go through the whole IVF kind of procedure up to the point you have the embryos, and then you freeze the embryos.
That is crazy. Interesting. Okay. So CJG says, hi, I'm anemic and recently had an iron infusion. Any recommendations to improve iron?
CJG, I think there are other things that should be looked at. If your iron is kind of chronically low, then your digestive health needs to be looked at. Why are you losing that much iron? Where is that iron going? Okay. One, that you're not eating enough food or different kinds of foods which are rich in iron, or that you're losing too much iron, or iron is somewhere stuck in your body and it is not bioavailable to your system. So there can be all those issues. So I will have to look at your whole health. How's your thyroid health? How's your liver health? So that you don't have to go through this issue again, unless there is another medical issue for which you have to infuse. But looking at your whole health, because whenever we are deficient of something, okay, any kind of mineral, vitamin, that means your gut health is compromised somewhere. Yeah? And that is why your body is not able to absorb, or it is leaching out of your system. So we need to plug that. We need to improve our gut health so that whatever you eat, it stays in your system. Yeah. So I don't know if it makes sense for you, if you can think of your health, how your rest of your health is. But otherwise, recommendation is that if you do have infusions are also, a little bit harsh for the system, because a lot of people then get issues. For example, itching starts to happen or something on the skin, because it is a lot of iron that is coming into your system. So your body needs to deal with that. But long-term solution is we need to find out what else is going on with our health. Then work on all those different parts. And then there are herbs that can be prescribed.
Wow. Okay, good. So thank you for that. Brooklyn Cali, I got you. I see I skipped your question, but I found it here. So Brooklyn Cali wants to know, what if I have a hormonal disorder, but haven't tried to have a baby yet? I'm 35. Should I freeze my eggs?
So you have a hormonal issue, yes?
Yeah, it's what it sounds like. She's saying she has a hormonal disorder. She hasn't said what it is. Maybe I can get her to clarify. Hey, Brooklyn, give us a little bit more information about that so we can what is a hormonal disorder, if you don't mind to clarify. I'm going to get another question answered in the meantime while you type, but we got you. We'll come back to you. Yeah. So Bayou here, I think it's Bayou. I'm glad you made it. I saw that you thought you missed it. She says she's 41, trying for baby 3 with her husband, but have 1 extra each. Just had his vasectomy reversal in January. Okay, we got to come. I'm not sure if there's a question there or just a comment. So actually, Brooklyn wrote to us. So we're going to go back to Brooklyn. So Brooklyn says she has
Yeah.
Say that word. So Brooklyn has what? Say it.
Hyperprolactinemia.
Okay. And
there is excessive prolactin in the system.
Okay.
Yeah.
So so talk a little bit about, define that a little bit more, and then should she freeze her eggs?
Yes. So if you have hyperprolactinemia, I think you probably are on some kind of medication, depending on how much it is. Also, anybody who has got high level of prolactin needs to know that there is a close link between stress levels and prolactin levels. The higher the stress, the higher the prolactin levels. And then one of other major thing is that there is some kind of growth in the nervous system which causes prolactin to go higher. So that's where they give you more medication. So I don't know if that is the case with you. But working on stress level is one strategy to work on that. Yes. And in your case, at 35, you should still look to, yes, if you're not with the partner, if you're not looking to conceive yet, then freeze your eggs. It is still not easy process, but it is better to, do that and have some eggs frozen. By the way, even with egg freezing, it's not a given that only single cycle is going to be enough for egg freezing, right? So there may be 1 or 2 cycles you might have to do, depending on, because with hyperprolactin, what happens is it is suppressing the ovulation, right? So in which case it becomes like a double issue. So I would really encourage you to go and see a herbalist, go and see somebody, who can work with on a long-term strategy as well, and then still freeze your eggs by all means, yes.
Okay, good. Very, very good. Thank you, ladies, for popping in. Again, take a moment to tap our boxes to give us some hearts, give us some love. Let's let TikTok know that you appreciate that we actually have a live professional fertility specialist giving you all this straight wisdom for free, and that I'm here. So let's tap my box, tap her box. Let's give us some loves here. Lots of hearts, lots of gifts. I want to check in with you, doctor, because we actually didn't coordinate time for this live. Do you have another 10 minutes? Can we go 10 more minutes?
Oh, yeah, that's fine.
Okay, good. So it's 10:30, so we're going to go 10 more minutes. So if you guys have the ability to share the live, what you think with people who, friends of yours, you think you should pop on. Bayou. Okay, so I'm going to come back to you because I have the full thing here. So Bayou says first, she's 41, trying for baby number 3 with her husband, but they have 1 extra each. He just had his vasectomy reversed on January. She wants to know, what are her chances? Their youngest is 5. His sperm back to normal. Is that what this is? It looks like there's some typos in this, but I think she's trying to say that his sperm is back to normal. Hopefully TikTok lets me say that word.
Yeah.
Okay.
Because it takes a while after vasectomy for the sperm seminal fluid to become normal. Yeah.
Okay. So she wants to know, what are their chances?
How old is she? Said she is?
She's 41.
Yeah. So as long as your partner is healthy and sperm quality is there, you have all the chances, even at 41. So as we were discussing before, he can do some, deep abdominal massage. Fertility massages men can do as well, especially after vasectomy. It will work really well. It will help him to heal. It will help with the sperm to, get healthier as well. He can also take herbs. The herbs that I give, for example, for 3 months for men, it's guaranteed. Whatever your number is, we'll double it in 3 months. So he should be doing all of that. And then, of course, you should be also preparing if there is no other health issue, just keeping yourself fit. That's what you both should be doing.
Right.
And then there are all the chances. I always say, as long as you're menstruating and ovulating, then there are all the chances.
I love that. Can we talk a little bit more about this? I'm going to interject my own question, because there is a lot of conversation about what the woman needs to be doing. So when you have a healthy couple, whether they're in their 30s, 40s, or otherwise, what should the man be doing to make sure that he is providing healthy sperm from his end, right? What are some health tips for the man in fertility?
Men should be doing everything what women are doing. I mean, they should not be just leaving the women to deal with the thing, I think everything related to their health needs to be optimized. Physical fitness is so crucial for men. And do you know, any kind of handiwork that a man can do, it increases their testosterone levels, okay? If they can cut wood, if they can do any strong activity that builds a muscle, will build their testosterone. Yeah? So if your man is that inclined, then, even if not, that is something that you can do. It builds a man as well. It builds like that kind of masculine quality.
Go build something, honey.
Yeah, but it's a scientific fact. So you can improve on testosterone this way, as well as other things, no smoking, no drinking. If you're really serious about it, you should be off those things until you get pregnant. There is just no, it's not like, okay, once a week we can do that. No, we can't, because it does affect sperm quality. Sperms and eggs are very, very sensitive cells of our body. Okay, whatever you eat, whatever you think, whatever you're doing in your body, it affects them directly. So other thing is, with men especially, to have really healthy pelvic regions. So exercise is good, but not excessive amount of cycling, for example, doesn't help with sperm quality. Yeah. So if somebody is cycling, but cycling a lot of it, that can damage your sperms as well. And also heat related, if you're putting laptops on your lap, men should not be doing that. There are studies to say, why take a chance? And, that's my theory. Why take a chance? Put your laptop on a desk or something. As well as I do recommend for men and women equally is to use really, really cold rinses for your genitals. Okay. To use almost like doing ice bath, but doing it for your what I call yoni, the vulva and the vagina, and for men to soak themselves in really icy cold water. And actually, you should try that before you are kind of going to have sex. Yeah. So when you're going to try for baby and you are in that ovulation window, both partners should have really, really cold shower. Okay. And really cold rinse, especially for your lower parts, and then go and do it, because it's going to be one that is going to be really, really spicy. And secondly, it improves your chances because of the blood flow.
Go cold and then hot. Okay. Go cold and then turn it up. I like it. Now, I like this question here because I get asked a lot about the regularity of my cycle. So I had a regular period, but many women don't. And so Naja's here says, when period gets irregular in your 30s, will this affect your fertility?
Yes, irregular period means that the hormones are not at a consistent window. Yeah, our hormones, our blood sugar needs to be in a consistent window. Okay, so within that window they can fluctuate, but they can't go above and below that window. So when you are not having regular period, or you're not having regular appetite, you're not having regular stools, you're not having regular sleep, it all means that system is not balanced. Yeah. So it is important for you to have regular periods. And not to say that if you don't have regular period, you may still be ovulating actually, and you still can get pregnant. But it is good to have regular cycle. And your cycle is linked, your hormones are linked to your sugar levels, okay? Your blood sugar levels. So if you are someone where blood sugar levels are going up and down drastically, that doesn't help with the hormones in any way. So have I answered the question?
I think so. I think that's a very good answer to that. Like, you've got to get that period regular and you have to find out why it isn't. Okay, guys, so we have 5 more minutes here. I'm scrolling through the questions. Can you guys give us some love in the meantime and let TikTok know that you love this live? Just tap our boxes, send us gifts. Okay, good. And I am just scrolling through. Okay. Will you recommend a woman in her early 30s to freeze her eggs if she hasn't found a partner yet?
I would recommend, if money is not an issue, everybody should freeze eggs, yes. And actually sperms should be frozen as well.
Oh, wow. Freeze your sperm and your egg. Okay, good. So then, is blood sugar affecting our hormonal balance?
Yeah, 100%. Yeah. Okay. Blood sugar is the main thing, because body system only recognizes your nutrition in the form of blood sugar. Yeah. So blood sugar has to be within a consistent window for your system. Because it is dependent on your body weight, it's dependent on your body mass, and how broad you are or how thin you are, all of that. So yes, it has to be consistent.
Okay, good. And then Tiva wants to know, what can we do to ensure ovulation? Trick question, huh?
Spicy answer for that. Ovulation, the best thing for ovulation is the big O. The more you can do that, whether by yourself or with a partner, because it is such an amazing moment, and if you are able to reach orgasm, and every woman should have an orgasm a day, I think, according to me, that improves fertility. And when the more we can orgasm, that's when you release the best quality egg. Okay. Same for men. They release best sperms come forward when you have an amazing orgasm. So same for women, and that improves. That is actually one of my tactics to encourage women to do that, even themselves, to bring your body and mind into that alignment.
Wow, that's fantastic. I say nature knows what to do. That big O has a purpose. That big O has a purpose, but that's interesting. I didn't know that. So I'm scrolling through. So Bayou wants to know what herbs. So you missed this part, Bayou. She's not really able to prescribe herbs as a medical doctor or recommend them legally. You know, she'd have to have a consult with you and to find out exactly what herbs you need. She did mention that just simply going out and purchasing herbs from your store, local nutrition store, one, they may not be at the dosage amount that you really need. And two, it might not even be what you need. And so it could just simply be a waste of money. Probably won't hurt. And maybe accidentally it can help. But if you really, like you said, you're 41. So we're looking at time here. You want to work with an herbalist. So I think she does telemedicine. Like you can reach out to Dr. Paul directly and she could work with you telemedically, or you can look for an herbalist or nutritionist in your area or someone who does Ayurvedic medicine and they can prescribe for you. Did I learn well, doctor?
You did really well. Thank you.
I'm a fast learner. I'm a fast student. So let me scroll here and make sure that I didn't miss anything here. Any questions? You guys, we're going to be ending this live here shortly. So somebody was been eating dried apricots, which was life-changing for some reason. For iron. Okay, for iron. Great. Okay, guys, so I think that we have answered all the questions that have come through on this live. We've been at it here for almost an hour. I really appreciate you guys hanging in there with us. Where do you find an herbalist? You know what I would do if I were you? I would go on TikTok and I would search for herbalist in New York City. And then you can always go to Google Maps. Go to Google Maps and type in herbalist and filter it to find one near you. But you can also do a tele-appointment with Dr. Paul here. She does telemedicine and she can send it to you. So you have options here on how to find an herbalist in your area. How to find a nutritionist. Anyway, I'm going to be doing more interviews with fertility specialists like this around the world. She's in London. And again, with telemedicine, good. Oh, you're in Scotland, Bayou. There you go. So reach out. Reach out to Dr. Paul. If you're in Scotland, you're not too far away. Might be able to hop on a train and get over there to see her in person. Anyway, you guys are so welcome. If you could just, let's do like a round of hearts, a round of gifts. Tap my screen, tap Dr. Paul's screen, tap somebody's screen to just show TikTok that you really appreciated this live, that you want our content pushed out. Follow Dr. Paul. She's always doing lives. That's how I found her. Yes, thank you. Thank you, user 9606716 for the rose. Like, just send us gifts, hearts, loves, whatever you know how to send, just to let TikTok know that you really appreciated us. That's an important part of this, because that's how our messaging gets put out. Obviously, women don't have truth in fertility. You just don't have truth, and you have to go to platforms like this to get it, right? So anyway, thank you guys very, very much for tuning in. I'm going to figure out how to get this posted on YouTube. I will definitely be making clips of this available as well. I do have a YouTube channel, so does Dr. Paul. So she and I will work together how to get this available to you guys so you can catch the recordings and things like that. Anyway, again, I'm going to be signing off here in 5 seconds. You guys have 5 seconds to tap those screens. I'm at 8,000 likes. I can't even believe I'm at 8,000 likes. Can you guys get me just to 10,000 hearts really fast? Just well away. Tap my screen. Tap my box. Tap her box. Tap it, tap it, tap it, tap it, tap it, tap it, tap it. Okay, and then we're going to be signing off here. 5, 4, 3, 2, 1. We love you guys. We're out. Thank you so much, Janet. Thank you for the love. We appreciate you guys. Have a good day. Stay tuned for more information from Dr. Paul. This is just the beginning. Okay. Bye.